Ramaphosa going through to Mpumalanga this morning to assess the province's response to the COVID-19 pandemic. We're showing you live footage coming in from the province there of the president arriving in Mpumalanga. The province currently accounts for 0.8% of infections nationally. The president will visit the Cyril Clark Secondary School and the Rob Ferreira Hospital in Mbombela. Our reporters Pepile Kunene will be joining us anytime soon to give us an update of the president's itinerary as he goes through to Mpumalanga this morning. 0.8% of the province's infections tally in terms of COVID-19. The president, one of the lowest in the country. So the president going through to see the province readiness in terms of these spikes that we're told about, the surge of infections, especially during the July and August period. But also another story we're following this morning is right behind our studio here in NASREC. Dr. Masuku is inspecting the NASREC facility. Let's go there live.
Just say the experiences from a perspective of a worker who's working here. Once we're done with that, we go back to our protocol in terms of going at that side. You get done, and then you can be allowed to go in as per what we have already discussed. Is that okay? Yes. Okay, I think okay. Ready, Mr. Ofalaga? Okay, MEC, I think the floor is yours. You can maybe get a bit closer.
Good morning, everyone, and thanks for making time to join us to come and visit our first functional created quarantine and isolation center. This is a center that we built over a period of 2 months. It has got 420 beds for quarantine and 50 beds for isolation. It also has got a spare capacity of over 100 beds that can be activated when the need when the need arises. We are quite impressed. Firstly, the main thing that I was worried about, because it's winter and we all know how cold it gets in NASREC, so I was actually quite worried about the temperature inside. But I think the installation of the high vac and all the air conditioning system has actually been very much impressive. It's quite comfortable in there. There are some few things that we have noted as we went around, even talking to staff and also talking to the patients who are here, these are things that we can be able to sort out going forward in terms of the hygiene and how we upkeep our pollution actually services. And it's a great honor to have such, and having to put up some of the beds in this space. And this is an area that we can use for pretty much very, very stable patients that just need a bit of observation going forward. But we are quite impressed, and Dr. Naidu, who's a center, we call him a CEO of this hospital, of this center, and we are working with physicians, particularly the physicians that are coming from Cuba are actually based here. We've got the clinical associates and some nurses who are based here. So we do a whole lot of work up in the morning when they need to be checked, and they've got support from Chrisani Paragwanas and Helen Joseph when they require more assistance. So it's one of these centers. We are putting up hospital beds now for patients who will be sick, who will be requiring some help in terms of observation. So we're finalizing that process today, and the beds will be ready in the next week or two, which will be quite helpful to decongest the hospitals around the south of Gauteng, including up to Sidibeng and up to Carltonville and so on. And thank you so much for making time to be with us.
Thank you, MEC. Like I said, I think maybe by show of hands, I'll point at you. You just mentioned the media house you are from, and then you pose your question. I'm raising a hand. We'll just allow 2 rounds of questions, and then we allow the other people that we said will come through. Okay, I see a hand this side. I will start 1, 2, 3, 4. There's 4 hands that I've noted for this first round. From this side, you can start is 1, and then it's 2, and then it's 3, and then it's 4. Yeah, if we can start, Malungan.
My name is Malungan. Amidst the numbers in terms of the people that are currently here that have tested positive, and those that are still in quarantine or suspected cases, and also in terms of the beds, is this one of your biggest facility as yet? Those that you have to build within a space of 2 months.
Thank you.
Okay. The second question.
NEC, there have been reports that there have been people who have been left to die in these isolation units. What's being done by the department to ensure this doesn't happen?
Okay. The third question.
Okay, the first question was actually taken care of by my colleague.
Okay.
And then the second one that I wanted to ask is, who exactly is employed at these facilities? Is it the same employees under the Department of Health who are at the hospitals, or have you procured new employees?
Okay.
Yeah.
Mine is covered.
Okay, I think there are essentially 3 main questions, MEC and the CEO.
Okay, maybe CEO can answer the one on the number of patients we have.
Yeah. The number of yes, we can cater for 420 isolation and 50 quarantine, as MEC mentioned earlier. We're sitting now with 130 isolation and 8 quarantine patients, and of that the females are 2/3 of the numbers that I told you about. So we got now at least about 200 and plus or minus 200 beds that is available for isolation and 42 for quarantine. And I think one of the questions was with regards to the staffing.
Yeah.
Yeah, the staffing here is, as far as the clinical part is concerned, it's mostly redeployed staff. Right? There are a few new nurses that were employed as part of the COVID stimulus package, and the staff that we have here now, as the numbers increase, we'll have to complement them, and those will be maybe new staff, newly appointed staff. But at the moment, it's all redeployed staff from the existing resources. Yeah.
Okay. Sorry?
Dr. Naidu.
Dr. Naidu.
First name.
Yeah, first VIS.
Yes. Yeah. This.
Okay. No,
Okay. Let me see the issue around the death.
yes, no. We are talking. I'm certain you are talking about what you saw on the social media, which was escalated to the minister. Yesterday, we dispatched a team from the MEC's office to the family. And it's not really in a quarantine facility. It was in a hospital in Tembisa. That incident where it occurred. We are investigating. A report will soon be shared with the family and shared with the public and with the minister of the circumstances, surrounding that particular aspect of food provision, and certainly the issues surrounding his demise. We like to send our condolences to the family. And also to the community and friends that actually knew him. The whole process will be followed in terms of our own quality assurance report, and then we will take further action and be able to provide that information to the public. It's a regrettable circumstances, the way it sounds and how it came across, and it's something that we wouldn't want to see it happening anywhere in our facilities.
MEC, there's a question that I think maybe you can elaborate a little bit more in terms of the additional capacity that we are bringing into the health system. Because I don't think it was just meant for just here, just a direct question to say, are we relying only on the staff complement that we have, or are we bringing in additional capacity into the health system to assist with this?
Yes, we have been procuring and contracting a lot of staff, particularly for our existing facilities like Bara, Tembisa, Kalafong, and all other hospitals. And some of these facilities will also be actually run purely by people who are coming from outside the department. We are also creating a central reserve force which will help us to replenish where there is a shortage and where there is a need to even rest some of our staff members. So this process of contracting and hiring, employing staff is a continuous process. It's not going to stop anytime soon. The more the better, and we will be able to manage patients properly.
Thank you, MEC. I'm allowing the last round of questions before we allow the two people that have agreed to talk to us to come out. Can I please take those that are asking for the first time, and then just, if you want to repeat, just listen first if they're not asking the same thing that you want to ask. I see a hand here. It looks like there's only one follow-up hand, so I'll give you that chance as well. You can start.
Can you just clarify if there's oxygen supply at this facility and what type of patients are admitted?
No, there's no, at the moment, there's no oxygen supply. We're looking at various options that we can be able to actually put up. One of the options is to have concentrated oxygen. And the patients who are here are patients that, in essence, don't require much medical intervention except observations that will be done in the morning in terms of temperature and also other vital signs. So in these types of facilities, it's only very much stable actually patients. But we are not ruling out the fact that we might have to at some point escalate the service, as we are putting up extra hospital beds for patients that will be requiring intervention. It might mean that if the numbers increase, we might need to increase the capacity here, because I think it is basically suitable to cater for such, only if it has got staff and also the equipment that is necessary.
There was one follow-up question, which is the last question.
We've been getting complaints from nurses and other healthcare workers that the facilities such as this one are actually extremely cold for the patients who are living in here, and a lot of people who are having to go under quarantine are avoiding at all costs having to come to places like NASREC, because they're told that it's very, very cold. They get little to no attention. And I just wanted to circle back to the question around deaths. Have there been any other deaths at these facilities?
There have not been any deaths in the facilities of quarantine. That's the first one. I think let's also dispel, I think it's a rumor. And sometimes people do spread fake reports and fake news, and that's the reason that some of the times we come out as the office of the MEC to ascertain some of the things. This visit was not a pre-arranged visit, it was a surprise visit, so that we can be able to get the actual situation as it actually occurs. Yes, indeed, all of us understand that NASREC do get cold. But if you enter the air conditioning system that has been put into place, the high-vac system that is put in place, I'm pretty much impressed with it. And the temperature within it is very much quite friendly actually to patients. And I think if you do get a chance, you can actually also from your side able to appreciate it. But I think it's important that we must always, when we get reports, particularly in social media, we have to make sure that we verify the veracity of the reports, because a lot of wrong news and fake news do spread, and they spread quite quickly, and they create a very bad perception in many areas, including the issue of the death. So in the facility like this, we have not had any or report any deaths in this respect.
Thank you, MEC. I think, colleagues, this concludes the end of this session in terms of the questions to the MEC. We are going to allow, there's a colleague who has agreed, generously so, to come and be able to speak to us and share her experiences. I'm going to allow her to come up front. She will introduce herself. I'll give her maybe 2 minutes or so, just to relate her experiences.
No.
And then I think once she's done that, I'll allow a round of questions just for clarity seeking. Mama, these are the members of the media that you've agreed to talk to.
Yes.
They just want to hear your story. How are you doing? And since you arrived here and so forth, who are you? And then they'll just ask 1 or 2 questions, just to gain a better understanding of your experience since you got here and so forth.
Okay.
Maybe you can start by introducing yourself.
My name is Sekopudi Shosiani. I'm 41 years old. I was admitted here last week. That was on the 24th, and I'm already started at home with my kids who were also positive. They quarantined at home. As for me, my first time here, I got a welcome from the nurses. I was given a bed. It's separated in cubicles, but for me it was comfortable. And then when you needed help from any nurse, they help you with whatever you'll be asking for. We were giving food at the right time. The place was clean. For me, there's nothing that I can complain about. Yes.
Okay.
That is all. Yes.
I think I'll allow a round of questions just to get further clarity, because you can imagine.
Must not interrogate her.
Yes. Yeah, because you can just imagine she's just sharing experiences, but obviously maybe there's certain clarity that you need. Any rounds of questions? Then there's one raised. Okay, I see the same hands as last. Yourself and yourself. Mama, when you address now, you can just look that way, even though the question comes from this side, that you are always facing the cameras. They will ask questions one by one. I think, let's go. There's only 3 hands that I saw. To start with the first hand that I acknowledge.
Sorry, Ma, Popoto, right?
Yeah.
We just want to know, you're not worried about any stigmas when you're going back home. How was the reception at home when you were coming here? Because a lot of people have stigmas around people who've got COVID-19.
She will respond, then we go to the next question.
Okay.
Them one by one.
That one I know about it. I've already dealt about it. We are staying in a complex where I'm from. So they already knew our neighbors because they are the people who are associating with us. My husband went first because he was the one who tested positive. He's a nurse at Charlotte. Then we had to test after him, after the result came positive. Then me and the one kid of mine tested positive. But the stigma, I know about it. I think by the time when I was here, I've already cancelled myself. I know the stigma is there, but I think I can deal with it. Yes.
There was a second hand.
I was going to, hi ma'am, it's good to see you.
Yes.
I was going to ask, why did you choose to come and be treated here instead of, I know some people choose to be treated at home. Did you not have that option?
If I had my way, I would have been quarantined myself at home. But we are staying in a small flat. We are 5. Actually, I didn't count my helper. My husband went away for his quarantine, and then me, I asked my doctor to get me a space as well, so that at home it must be only my helper and my kids, so that we must not clutter. Yes.
There was the last question this side.
Yes. Ma'am, I just wanted to ask you, for people out there who are scared of, the unknown, if you could tell us how, how the experience has been for you personally. How do you feel right now? And, what do you think that you're going to need, some sort of counseling after this?
Yeah, counseling. I think the whole of my family. We talked about it with my husband. We really gonna need a counseling because my 8-year-old child who did not test positive. She tested negative. She is very traumatized. So I think as for the family, the whole of us, we really gonna need counseling, just for her to be calm. Yes. She is even scared to go back to school. Yes.
Okay. So, Mama, thank you.
One check that we just want to correct.
It's
in terms, I was told now by Dr. Naidu that there was a patient who passed on here 2 weeks ago. It was a 56-year-old gentleman who came in without symptoms, and he complained on shortness of breath, He was hypertensive, diabetic, and also RVD positive. And I just wanted to correct that fact so that we don't create a wrong impression. Thank you.
Can I go now?
Yes.
Yeah. Okay, thank you. There's one person.
Properly.
Yeah.
Your name, you spell the name properly, please.
So, Mama, just on the mic, on the record.
Yeah,
Just spell your name and your last name.
Oh, my name is Sekopodisho. It's SEGOPODISO.
Last name.
And my surname is Seane, SEANE.
Thank you.
Thank you very much. Okay, thank you, Miss Annie. Okay, we've got a gentleman as well who's going to address you. Then once it's done, we'll just take one worker. Then I think we go to the next phase. That you can get closer. The same process will apply. You can stand here, you talk to the mic, and then you just introduce yourself. Who are you? How old are you? And then you just for a brief synopsis of your experiences. How did you come here, and how do you feel now, and the treatment, and your experiences basically since you tested positive. And then we're going to allow them to just ask one or two clarity-seeking questions so that they get to understand better your situation. Okay. So you can start by introducing yourself and then sharing your experiences.
Okay, good morning everyone. My name is Lebogang, the surname is Nswe. Staying in Soweto, original from Mafikeng. This is my 7th day on quarantine here at NASREC. I was very sick and I went to Shavala Clinic. I tested positive, unfortunately, for coronavirus. But the doctor gave me a referral to come here. After coming here, it's been 7 days, no more. I'm breathing properly. Actually, the government has done a lot that we can be proud of. Actually, the place is clean, the food is good, the nurses are very, very, very friendly. It's really, really, really not bad, and it contributes towards the getting better of an individual. You know, when you've been sent to a government facilities, you get more worried about getting better than the facilities itself. You know, but really, 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 it's not that bad. Honestly, I feel good. I feel okay. I feel ready to go home. Thank you.
Okay, we're going to just allow just that round of questioning. If there's anyone who wants to clarity-seeking questions, if there is none, then we conclude this process. Is there anyone who wants to add anything?
I wanted to find out when you are in isolation, do you guys exercise? What regimes do you guys do? Your routines during the day?
Okay, listen. There's no anything in proper. We do ourselves walks inside, as you obviously cannot go outside and all that. And the nurses also helps for you to mobilize and be able to get going. You know, but there's no like organized exercises and all that. It's up to an individual. Yeah.
Okay, it looks like I think we were quite clear. Oh, if you can just spell your name, your surname, and the age.
My name is Lebogang.
Spell it.
Lebogang. The surname is Nswe, Ntshoe, and I'm 43 years of age.
Thank you very much, sir.
You're welcome.
Yes.
Thank you.
Do we still have the workers coming, or we're done here? Okay. Okay. I think we are done. What we're going to do now is that, because I think you've heard a little bit from the CEO explaining some of the things here, we're going to go to the next process that we spoke about of allowing members of the media to have access, as we have agreed. We're going into the mail section, and then we're gonna go in groups of 3, as we have agreed, still maintaining to the physical distancing.
Coming out of that Gauteng COVID-19 facility, the MEC for Health in Gauteng, Dr. Bandile Masuku, is there to make further inspections.